Yeah, so I went to MD Anderson. I think it was a great opportunity. I hope to do hand surgery, but a big component in hand surgery, especially if you're doing like reconstructive like trauma stuff, is that you're pretty well versed in microsurgery, and so MD Anderson probably has the best, if not, one of the best, if not the best, collection of microsurgeons in the world. And so it was a great privilege to come and learn from them and observe them, but also, to participate in the research that they were doing. They're like a powerhouse in research, and one of the faculty members here, Dr. Marichli, does a lot of sarcoma research, extremity sarcoma research, and so that kind of played into what I wanted to do. So, along with the clinical research, that was pretty big. Just being around everybody, being around all the fellows here that are also like amazing, come from amazing programs and are super well trained, and the ability for them to teach me, and the opportunity I had to learn from them was also immense. So I think those are all the draws. It's kind of like a three component thing. The fellowship training that I'm going to get after I graduate residency will be, formalized hand training. So I did want exposure to a microsurgeon's perspective on, how to operate anywhere on the body. And so I think, that in itself is like really, really valuable. The highest honor for a microsurgeon is the Godina Fellowship, and we have one at Stanford, Dr. Momeni. MD Anderson, their faculty base now has three. So just to observe them and just to learn from them, learn, how, they stay calm through difficult cases and how they perform through difficult cases, something invaluable, and something that you wouldn't necessarily get too much of exposure just within the realm of microsurgery during a formal hand fellowship, although you do get some exposure to microsurgery. I think the breadth of microsurgery that they do at MD Anderson is immense, right? So they literally operate like everywhere on the body, head and neck, extremities, trunk, everywhere. So I think, yeah, I think if a lot of residents, and it's not just like it's just not like you know, my perspective. I think if residents are exposed to this type of breadth of microsurgery early on, then yeah, it's definitely, enticing. And I think I think it would have been a wonderful career, but I think I'm set on hand surgery, and that's, that has to do with like my goals and like global health, and what I plan to do in the future in that aspect. But yeah, I think microsurgery would have definitely been in competition had I been exposed to it a little bit early, had I been exposed to this type of microsurgery a little bit earlier. But yeah, it's been amazing to witness all this. So I think the main thing is you have to do something that you want to do. I think, PD year is a year to kind of not you relax and also kind of catch up on some of the social aspects of life that are probably missing from like first 2 years of residency. But it's also a time to kind of start thinking about what you want to do after residency. So if you choose something that you're just, you're just doing just to do, it's not going to benefit you at all. You have to, put yourself in a position where you either have time to, do research that you want to do or do clinical activities that you want to do, but also, look to have time to do things that you want to do with your families. Some people have families, some people are trying to get married. So I think that's really important to look at. But it's the main thing is to do something that you want to do and that you're excited to do. And this year is like super beneficial for that.